Hello and welcome to day 3 of Africa Health Week 2021. I'm Dave Sharp. I'll be your host and moderator for this, the final day. You can still carry on networking on this platform tomorrow, but in terms of our speakers and presentations, today is the final day, and what a day we've got ahead for you. We'll take a look at that in a moment. We've already had 2 brilliant days. If you've missed those days or any of the presentations, you can watch them again on catch up on the Future Health YouTube channel. Just go there, select the video from any of the presentations, and you can catch up there. And of course, for those that you watch or miss today. So why are we here? Well, our aim is for you to network, to join together on this platform, to obviously watch the speakers, to chat using the chat facility. You've already got the networking facility. And for any of those speakers that you are watching, if you've got a question for them, you use the Q&A box. If you've got a question that you see there, or it might even be yours that you desperately want answering, then you can vote and that'll nudge that question further up. Our moderators will choose those questions, and I'll ask those to our speakers at the end of their presentation. So you can also stay in touch with us on social media. Find us by typing in Africa Health Week or Future Health Innovations or Future Health, and use the hashtag Africa Health Week or Future Health. And you'll find us on the usual places: social media, LinkedIn, Twitter, Facebook, the usual places. So our aim is for you to learn, innovate, educate, maybe improve, collaborate, and to join forces so that we are continuing to create a global community of healthcare professionals, all with the single aim of improving health and well-being for the world's population. I say the world because we are going around the globe. We've already been in the UK with UK Health Week. We've had Arab Health Week, and next month, or in September rather, we'll be going to the USA and then beyond in the future. So, final day, where has the time gone? A packed programme ahead. Let's take a little look at what's coming up. Shortly, I'll be talking to Professor Edward Kunonga about herbal medicine and disease areas. Then we'll be looking at Babylon, making quality healthcare accessible and affordable for all. Siobhan and Claire will be with us. And then just before lunch, Mark Gregor will join us for mobile healthcare currency for the remote workforce. I'll tell you a little bit about the PM sessions later on. But for now, let's crack on with our first speaker. As I mentioned, he's going to talk about herbal medicine and disease areas. He's a professor and a director of population health management. He has a number of roles and a number of job titles, including public health consultant and a lifestyle medical and medicine specialist. And he is joining us now. Please welcome Professor Edward Kunonga.
Hi, my name is Edward Kunonga. I'm a public health consultant, an epidemiologist, and I'm also a certified lifestyle medicine specialist. And I'm going to be talking to you about herbal medicines in Africa. Are they a dangerous concoction or untapped potential? So throughout my talk, I'm going to be making a wide range of references to a number of studies, but in terms of declarations, I have nothing to declare. I do not work for any pharmaceutical companies. Whilst I work for the National Health Service here in the United Kingdom, my views are just mine. They do not represent the views of my organization. I'm also a professor of public health and policy at Teesside University, but I am doing this in my personal capacity. But perhaps more importantly, I am an African, I am Zimbabwean, and so I don't know whether that is a declaration of interest or not, but clearly this is an agenda that is very close to my heart, for reasons that will become very clear in my presentation. I also would like to dedicate this presentation to my late granddad, Benjamin Tafirenyika Kunonga, who was born before the 1900s, way before they had consistent records. So in the family, we never knew when he was born, but we related to some historical events, such as the arrival of the white settlers into Zimbabwe in 1890. And he said at that time he was already a young boy. So we know that he was born in the pre-1900s. And we also know that his estimated age was over 100 years, perhaps 105 or 110 years. And we know that throughout his life, he had very little to do with health resources. He barely used medical interventions other than his optician appointments. And you can see there him sat at his rural home with his glasses on. And this was perhaps one of the very well recognized stance and positions that he will take in front of his rural home. We know that he relied a lot on herbal treatments and traditional medicine. We also know that his lifestyle was very much conservative. His diet was predominantly traditional. You didn't really participate in all of these Western diets. Lemon tea was his favorite. He used to have a special brand of coffee, black coffee, that he would put lemon tea in it. And he used to rely a lot on traditional fruits, things that were grown on the ground, and also things that he could find. Grew a big orchard, which is still there even as we speak, which was a good source of fruits for the whole village, and relied a lot on subsistence farming. He was a family man, and he was so good at storytelling, very good at connecting with people. So I dedicate this to my late granddad, and the reasons will probably become a lot more clearer, but he was perhaps a good example of how modern medicine is not always the key to long life and good health. Health happens outside of hospitals, it happens in communities, and his life was predominantly based on traditional and herbal treatments. So I'm going to cover a few areas in my presentation. I'll talk about the burden of disease in Africa. I'll talk about healthcare access, availability, and the level of coverage in Africa, and how this relates to the agenda around herbal medicines and traditional medicine. I'll also talk about herbal medicines. Are they untapped potential, or are they dangerous concoctions? I'll touch on the safety and effectiveness of herbal medicines in Africa, drawing on some of the research that has been published, and explore the need for us to build on the untapped potential of herbal medicines, and how this requires collaborations between pharmaceutical companies, other partners, as well as working very closely with the local communities. So how do we define traditional medicine? So there are numerous definitions of traditional medicine, but my favorite is the one that comes from World Health Organization, which talks about traditional medicine in the form of a combination or the use of herbal medicines, animal parts, and or minerals, and or procedures that are based on or rooted in tradition and in cultural arrangements. So this would include things such as acupuncture, manual practices, and also spiritual therapies. But for the purposes of this presentation, I'm going to focus predominantly on herbal medicines, and all these other treatments are out of scope of my presentation today. So herbal medicines include the use of herbs, the use of herbal materials, herbal preparations, and finished herbal products that contain as an active ingredient parts of a plant or plant materials or the combination thereof. So predominantly medicinal plants is what I'm going to be talking about. And we know very well that each region in the world has got a rich cultural heritage of some of these approaches. But obviously, for the purposes of this presentation, I'll focus mainly on the African subcontinent. So what is the burden of disease in Africa in terms of morbidity and mortality? Well, one of the best resources for you to have a look at in terms of burden of disease in Africa is the Global Burden of Disease study that was done by the Lancet, continues to be updated, and it looks at burden of disease, both in terms of what is killing people as well as what is making people unwell. And that study then publishes country profiles. And I'll just, in the interest of time, just give you an overview of where we were in 1990 and what has changed since. So this is the burden of disease from non-communicable diseases. So these are the diseases that are not infectious, but perhaps related a lot more to lifestyle-related risk factors. So things like cancer, diabetes, cardiovascular disease, and the like. And you can see that in Africa, the burden was predominantly greater for communicable diseases, infectious diseases, as opposed to non-communicable disease. And you can see why in the past they used to be called Western diseases. As you can see, some of the Western countries, with the exception of Australia, having a greater burden of disease from these non-communicable diseases. And then 2019, the latest update, you can start to see how non-communicable diseases are growing in terms of their prevalence and impact in the sub-Saharan continent. Perhaps not yet at the same levels as the Western world, but clearly catching up. And that presents a lot of challenge in terms of how you meet those needs for the populations. So when you look at what has happened between 1990 and where we are, perhaps just before COVID-19 hit, you can see a massive reduction in communicable diseases, the infectious diseases, massive reduction in the number, in the percentage, and the burden of infectious diseases in the African subcontinent. And you can also then see, especially in sub-Saharan Africa, an increase, a growing burden of non-communicable diseases. So what we have gained by addressing infectious diseases, we seem to now be losing in terms of non-communicable diseases. And most health systems and countries are struggling with this agenda and looking at how best they can address that. Now, I'm just going to go through just a few countries, really, randomly selected, obviously Zimbabwe, because that's the country of birth for me. But the other ones, I've just randomly selected them based on the Global Burden of Disease study. So what causes the most disability and death in Zimbabwe? And you can see there massive reductions. To your left will be reductions, and to your right, the bar charts going the other way will show you areas where there's been increases. So reductions have been in the communicable diseases, pretty much in line with what we have discussed in the previous slide. And this addresses areas such as HIV and AIDS. And whilst we still have a burden of disease from that, it's nowhere near what it used to be 10 years ago. Neonatal disorders, lower respiratory tract infections, diarrheal diseases, TB, all of those, we have made significant gains. But as you can see, as I highlighted, in the opposite direction are things like ischemic heart disease, strokes, and also road traffic accidents. The picture is pretty much similar for South Africa, slightly different in the prevalence of diabetes, which is going in the wrong way for South Africa, but the majority are pretty much in line. And the significant progress South Africa has made on the other causes of death and disability, such as road injuries and interpersonal violence. You can see a similar picture, perhaps less dramatic for Nigeria. But again, the ones in red are your communicable diseases, massive reductions in all of those communicable diseases. And the next one is Rwanda, and you can see, again, similar picture, slightly different proportions. But what you can see is the growth that we've described in non-communicable diseases. Almost 20 almost 30% increase in stroke, burden of disease, and disability. Almost 35% increase in mental health issues associated with depression. So these are the conditions that populations will be trying to address and to deal with. Now, I'm going to talk about healthcare. So how do people access health services to deal with some of these conditions that we have talked about? So we know very well that the WHO describes three main priorities for health resource or healthcare financing that would give you an optimum level of coverage for a population. So the first one is, to what extent does the available finances cover the population? And then the next consideration is, to what extent do those services become available to the population? So how much of preventative services, how much of early treatment services, and how much of tertiary hospital-based care is covered by that state funding? Then last but not least, to what extent do people have to top up or in some cases ultimately foot the bill for meeting their healthcare? And these factors have got a significant role to play in terms of access to healthcare, because where you do not have large population coverage and there's limited services that are available and it costs you money, then that can be a significant barrier to accessing healthcare. Here's a graph that shows you the per capita spend on healthcare in 2014 for African countries. And apologies, it says very small graph, small print, but basically the point to illustrate within that is a significant proportion of African countries are spending less per capita for their population, and they are also getting poor outcomes. You can see the same for child health, per capita spend, quite a number of countries clustering in that quadrant that shows low spend and low health outcomes. And we know that there's an Abuja Declaration which says that countries should aim for 15% of their GDP to be spent on healthcare. And significant numbers of countries in Africa do not reach that 15% of your GDP threshold, which then means that there's limited resource that is available for the provision of healthcare, which also means that some services are not readily available on people's doorsteps as they should be. And then people have to find options for meeting their health needs, including self-help. And this is where traditional medicine, herbal-based medicines come in as that point of provision of self-care, but also seeking access to help and support from family members, from traditional healers, way before they reach the tipping point where they feel they need to present at healthcare services. So health resource availability is a big issue in sub-Saharan Africa. And how has this changed over time? Well, we can see that while some countries have made progress, sadly, a number of countries have gone back over the other way. The ones in red are countries that have seen a reduction in the prioritization of resources going into healthcare compared to other areas. And so this plays out in terms of what is available for people to access in terms of healthcare, and how people then come up with ways of meeting their healthcare needs using resources that are available or at their disposal. We also know that where the spend is allocated, there is a preoccupation with building big hospitals, and quite a lot of the spend goes disproportionately so to big hospitals than it does on primary health care. And this has got an impact in terms of what is available in people's communities and what resources they can utilize to meet their health needs. So we do have an issue with a growing burden of disease, a shift away from infectious disease, more towards non-communicable diseases. And we also know that the resources create a significant barrier in terms of availability, access, and the quality of healthcare at people's disposal. So how does this relate then to herbal medicine? Are they an untapped potential or dangerous concoctions? Well, a number of colleagues have been writing about this. This is a paper article that was written by colleagues from South Africa, where they looked at traditional African medicines and conventional drugs. Are they friends? Are they enemies? Can they really work together? And in their paper, they cite the oftenly quoted statistic from the WHO, which says as high as 80% of people in sub-Saharan Africa do utilize traditional African medicine. Some of them use that as self-care in the first instance. Some people use that on prescription, and some people use that in parallel as top-up of whatever modern medicine or hospital-based or clinician-prescribed medications. And that presents a number of challenges which are discussed at length in that paper, which include the effects that this can have in terms of drug interactions, the effect that some of the drugs can have in terms of how they are metabolized, side effects, and overall safety, but also the potential benefit that they can be synergistic when they are working alongside some of the conventional drugs, but the importance that research is done to really understand some of the factors to do with these medicines. So traditional medicines or herbal medicines, study done by colleagues in Lagos, Nigeria, which was looking at, so what are the doctors' attitudes towards the use of medicines in Lagos? And their conclusion was that doctors were aware that their patients would utilize traditional medicines or herbal medicines. Some of them, when asked about their own practice, did acknowledge that they do utilize some of these medicines. So doctors do know that patients would utilize these medicines. And if we could get a way of formalizing some of those, then at least these patients would come under the watchful eye of the clinicians. And if there are side effects, they are managed and the benefits are maximized. Here's another study that it looks at potential or drugs that are showing promise from the African subcontinent, from sub-Saharan Africa. So this is an appraisal of 10 potent African medicinal plants. I will not go through all of them in detail, but I'll recommend you to go and have a look. Fascinating research on the potential therapeutic benefit of some of these medicinal plants. And some of these, we are seeing them certainly in the West beginning to be used as complementary therapies. We know the use of aloe vera as an example. We know rooibos, which is now being used as a caffeine-free beverage, and lots of other different medicinal plants that have been used for years and years in Africa and are beginning to be utilized and to be co-opted in day-to-day lives. And that has been as a result of research. And what this paper argues for is for herbal treatments to be given the opportunity and the space for them to undergo the research so that we test their safety, their effectiveness, and also, perhaps more importantly, we know what dosages will be utilized on their prescription. This is a study around healthcare seeking behavior and utilization of traditional healers in Kalabo, Zambia. And the findings from this are fascinating, that people's priority or their escalation of their health concerns or their pattern of health resource utilization follows a pattern which is self-care, look after yourself at home, find remedies through your network of friends and family, usually herbal, usually cultural, passed on from generation to generation. If that doesn't work, then consult someone who is specialized in this field. Traditional healers, they are usually much closer without the need for you to travel. And the cost as well is usually relatively low. And in some cases, it will lead to improved outcomes. So weighing up the balance between the prohibitive cost of accessing healthcare against the relatively easier access to traditional healers. And then the people interviewed in this study will then say, well, if all of that fails, that's the point when you might need to go to the hospital. And we all know that sometimes that means people present late with advanced disease, and sadly, the outcomes for them are not as good. So we need to find a way of how we can incorporate this in a regulated way alongside how else people are seeking healthcare support and healthcare services. Another study looking at health-seeking patterns for HIV and AIDS patients in Malawi came to similar conclusions that people tend to prefer their tried, perhaps not tested, but passed on remedies from families and utilize those in the first instance, go on to traditional healers before consulting healthcare for cultural reasons, for access reasons, for affordability reasons, and for availability reasons. So we know that people are utilizing these treatments, and perhaps there is the need for us to revisit collectively on how we can maximize the benefits and reduce the avoidable harm from these. I'm going to touch on very briefly around herbs or herbal medicine and COVID-19. So we know that the arrival of the pandemic has created significant challenges. We know that certainly as we speak, most countries are in the beginning of the third wave. We know that the vaccine distribution has not been equitable, greatest injustice ever seen. And we know that there will be people who will die as a result. But at the same time, we know that our health resource was already overstretched in sub-Saharan Africa before COVID arrived, and will continue to be so, and perhaps further so as a result of the pandemic. So we know that communities have been looking at medicinal plants, and lots of formal and informal papers have been written about this, as well as social media circulation around the benefits of some perhaps household plants such as ginger, garlic, lemons, turmeric, all the way through to some special concussions that people have been describing as effective. They have not been demonstrated to be curative or preventative, and as a public health professional, I always advocate to people to only use the things that are tried and tested, and to ensure, especially with a disease like COVID-19, that people seek help at the earliest opportunity and do not rely on these herbal treatments that have not been tried and tested. But we know that there's lots of home remedies, and papers are continuing to be written about this, surveys looking at what are people utilizing in terms of responding to COVID-19. But we also know that there has been a growth in interest in an organized way. We saw last year in 2020, in the early stages of the COVID-19 pandemic, countries like Madagascar saying we do have a cure for COVID and that it works. We saw that there was a lot of interest in that, and sadly, that has been shown as not being as effective as perhaps it was being described. We also, the president in Madagascar was at the forefront of hailing that tonic, but also credit to him, was quick to recognize when this was not delivering the outcomes that people expected. My own native country, Zimbabwe, lots and lots of interest in different home remedies, but one of the very popular one is a leaf called Zumbani leaves, which people have been using to try and prevent and to manage COVID-19. And this is despite there not being scientific evidence to show its effectiveness. Uganda also did have its own herbal treatment, and Nigeria, the biotechnologist said he had identified a potent herbal treatment for COVID-19. We all know some of the issues that happened in Tanzania and the effect that it has had in terms of international relations. Lots have been written about this. There is a systematic review, which I will, in the interest of time, not go into much detail, but there is encouraging signs that research is beginning to look at the role that herbal medicines and alternative medicines could play in terms of addressing some of the challenges that Africa faces as far as burden of disease is concerned. So I'm just going to move on to the final section of my presentation, which looks at the safety and effectiveness of herbal medicines, looking at how do we explore and build on the potential and perhaps untapped potential of herbal medicines, and why it is important that this is a collaboration between pharmaceutical companies and governments, researchers, and the general public. So we all know that for every drug, there is specific guidance on its labeling. And this is very, very important in terms of effectiveness, but also in making sure that people are not subjected to preventable harm. So every drug, whether it's paracetamol, ibuprofen, or cancer drugs, or even in this case, vaccines, will always come with information around safety, around the uses, around the warnings, the facts, the directions, the drug facts, the inactive ingredients, and then contact number should you have any questions. And this is very important because it gives you the reassurance that this has been observed, this is what you should expect, and should you see this, you need to seek help at the earliest opportunity. And I think that's the challenge with herbal medicines, that often it does not come with this information. Often it lacks information on doses. So how much should I take? How often? When should I stop? When should I titrate my dosage? If my condition is getting worse or if I'm getting better, how will it interact with other things? And what are the side effects? And what should I do? Should I start noticing those side effects? So in the interest of public health protection, it is very important that whatever drugs we are utilizing are basically carrying all this necessary information. There is a tendency for people to think that if it's natural, it's safe, but we need to recognize that every drug will come with lots of issues, and you really need to understand what they are and what is the dosage that you need to be utilizing. We know a lot from the development of new drugs, that new drugs have to be trialed and tested for safety. Are they safe? For effectiveness, do they work? Do they work for everyone? Do they work more for others, people than others? And what is the dosage? And what is that dose-response relationship? So all these are things that we need to have in place if we are to, on a large scale, really advocate for the use of herbal medicines. This is the timeline for the development of drugs. So it takes up to 12, if not longer, years for drugs to be developed. And they follow through all the different stages, from the initial discovery, understanding what is the active ingredient, what is the mechanism of achieving the desired effect, the preclinical testing tried out in labs, tried out in clinical trials, phase 1, phase 2, phase 3 trials, which are basically an incremental recruitment of people from a few individuals to thousands of people participating in those trials. And then there's the licensing process, and then the drug then ends up on the market. So that is the timeline, and quite a lot of this is driven by a number of factors that pharmaceutical companies consider. McKinsey did a review looking at should sub-Saharan Africa make its own drugs. And their conclusion within their review is that when pharmaceutical companies are looking at which drugs to really invest in, they look at the likely impact and they look at the feasibility. And they usually go for high impact, high feasibility. And for them, impact is whether they've got a customer at the end of it. And sadly, for a number of these conditions, the interest is perhaps not as great in Africa as it is in other areas. So we need to think about how research and development of these drugs would need to be funded in an alternative and different way than we have traditionally funded research and the introduction of new drugs. We also know from that report that you can look at the developmental stages for the pharmaceutical industry, ranging from basically having no industry all the way through to having an innovative industry. So if we are going to achieve the potential from herbal medicines, really the pharmaceutical industry in sub-Saharan Africa needs to grow and needs to move more to the right of the screen towards being innovative, being a fully developed industry, perhaps than what it is at the moment. And COVID-19 and the vaccine production has highlighted the over-reliance of Africa on the West and China and other countries in terms of the capacity and the capability to develop products to meet its own needs. So herbal medicines will be a great opportunity for Africa to take that forward. The WHO did a survey looking at traditional medicines and what are some of the big issues for member states. And these were the responses: lack of research and data for herbal medicines and traditional medicines, lack of financial support for that research, lack of regulation and mechanisms to ensure that these are safe, lack of education and training for the providers, lack of expertise, and also broadly lack of appropriate mechanisms to control and regulate herbal products. So these are the areas that would really need attention and need addressing if we are going to realize the untapped potential from herbal remedies. And I believe that the medicinal plants, which are traditions of yesterday, and perhaps in sub-Saharan Africa, they are traditions of today, could move and become the drugs of tomorrow. I believe that there is that potential within those drugs. We know that people did survive and did manage to meet their healthcare needs without always the conventional drugs. And if enough research and attention is paid into this, then we can see a significant improvement. So perhaps to answer my own question, herbal medicine in Africa, are they a dangerous concoction or untapped potential? I strongly believe it is untapped potential. However, without regulation, without the investment, sadly, some of them will remain as dangerous concoctions and perhaps cause more harm than they do provide the benefit. So hopefully that has given you an insight into the opportunities herbal medicine produces for Africa, but the requirements for us to really have a joined-up approach in resourcing this area so that we can tap the untapped potential and address some of the challenges that we are facing in Africa. Thank you very much.
I'm delighted to say Professor Kunonga joins us now. Can I call you Edward?
Yes, that's fine. Thank you.
Great to see you. And thank you for sharing that information, particularly the story of your grandpa. We were all sitting here fascinated. He sounds an incredible man. And to live to over 100 years old with the things that you talked about, he's a role model, an advocate for traditional herbal methods, isn't he?
Yeah, absolutely. I mean, he was a pillar of the family, and we owe a lot to him. And it was not until I started working in the health sector and public health and doing lifestyle medicine that I actually reflected on his life, and it had such a profound impact in terms of understanding, without the benefits that we now all have of science, how he used what was available to him. And how that led to improved health outcomes. And he was not just unique. I'm sure if we had the time, we asked people, they would be talking about their grandpas as well. So, yeah.
I think certainly in my childhood, it was always passed down through families, these methods, and you never really questioned why. I remember if you got stung by a stinging nettle, my mum would say, wet a dot leaf and press it on the sting. And I mean, I wonder whoever discovered that. But these things, I don't know, are they fading out, these traditions that are being passed down, do you think, maybe in Africa or beyond?
Yeah, I think one of the biggest challenges for us in Africa is that a lot of our history was oral tradition and passed on through storytelling and never really properly documented. So I'm afraid that there is a lot that, had it been documented, we would have been utilizing. I mean, in my village, it was very rare to hear someone going to the clinic because you had to travel and people had to make do. And some of these things did work and we saw improved outcomes. But when the person dies, sadly, they go away with all that knowledge. I mean, I wish if I could reverse time and still have the insight that I now have, that maybe I would have been visiting my granddad every other weekend and scribbling down lots and lots of notes. So sadly, the tradition gets passed on from person to person, never really documented. And when the person goes, they go away with all that knowledge.
And I think you've hit the nail on the head there. You know, we're hearing a lot in the public domain about clinical trials, about data, about case studies. And of course, with those traditional villages that you spoke about, they were the original clinical trials. The proof was there. But as you say, without science backing it up, which we all seem to rely on rather than storytelling, and those stories become mythical a little bit, we've probably missed out. How do we re-energize that, those case studies from tradition and get them back in the public domain? What do we do?
So I think there's an urgent need because we still have, like my parents' generation, who will have had some of that information passed on to them. We need to document that. We need to really invest in research and engagement with those communities. And we need to make sure that we do these things properly. I mean, we have seen, sadly, with the COVID-19 pandemic, an over-reliance on some of these untried and untested herbal medicines. And sadly, for some people, it has ended up with poor outcomes. So we really need to respect that herbal medicines do work, but we need to make sure that we subject them to the same level of rigor that even your paracetamol or Brufen goes through before it can be utilized safely. Otherwise, we end up harming people with the best intentions. So I think it's a meeting of how do we capture what we already have, but at the same time subjecting it to the same level of rigor so that we can satisfy ourselves that these things are safe, they're effective, and when they should be utilized. So it's not a blanket, use this for whatever ill you have. We need to make sure that we understand the indications and the contraindications of some of these treatments.
There's a little bit of confusion. You mentioned the COVID-19 pandemic there, which is obviously worldwide news and continues to be so. Is that this idea that the life cycle of a drug goes from, being discovered through to clinical trials, different stages of those trials, which can take 12 years. And here we are, barely a year after the pandemic with a vaccine. And people are very suspicious, aren't they, of how have we gone from 12 years to 9 months? I did read somewhere that the professors at Oxford University had already begun the work. They just needed the acceleration of funding and the political will. What would you say to that?
Oh, you're absolutely right. I think the reason why drug development, whether it's a vaccine or a new cancer treatment or a treatment for some of the neglected tropical diseases, the reason why it takes forever is exactly what you've highlighted. There is no political will. There is no financial interest in those who can fund research. And there is, the governments really have got their interests elsewhere. I think what COVID-19 did was it brought all of those things together and demonstrated to us that where the political will is there, where pharmaceutical companies are willing to invest, where the governments are willing to support that investment and underwrite, we can do these things in breaknecking speed. So I think one of the challenges that we now have is if conditions and if some of these problems affect a part of the world that is separate from the Western world, then it is not in their interest to be providing the funding for research. And that's where, from my point of view, Africa, and that's the biggest lesson for me from this conference, the takeaway message is we can't be relying on others doing what we need to do. We can't be relying on philanthropic organizations. We can't be relying on international aid to solve Africa's problems. We are seeing that with the vaccines at the moment. Here in the United Kingdom, we are vaccinating 20-year-olds. And yet in some parts of Africa, even healthcare workers and the most vulnerable people still haven't had access to those vaccines. So I think for me, the solution lies in Africa. We've got the resources, we've got the herbs, we've now got an increasing body of people who have been trained who can do this. Let's pull that together and start developing local solutions for local problems. And let the West come and join in and support our efforts rather than the West taking over the agenda and we sit in the passenger seat watching them drive at a speed that is convenient to them.
Yeah, I would agree. I mean, I'm sitting in the UK also, but I would absolutely agree. And that's the whole point of Africa Health Week, which is running over these 3 days, is to highlight all of the good work and the potential in Africa. And as you say, you know, let's move that on. My grandparents, like yours, used to say prevention is better than cure. And of course, hospitals and doctors and medicine in general is set up to cure. But I'm sure a lot of these herbal solutions are proven to prevent illness in the first place. I mean, even as basic as my mum used to say, eat your vegetables, you know, eat more fruit, drink more water, get some exercise. And herbs and medicinal solutions like that have a role to play.
Absolutely. I mean, the whole preventative medicine agenda is built on basic pillars of good lifestyles, good nutrition, physical activity. My granddad never went to a gym. My granddad never went to Weight Watchers or any of these Slimming World products, but he was not obese. He tilled the land. He would walk to his neighbors. My granddad never had depression or any of these because he was a family man and he was interacting. And there were other things that he would take as part of that preventative agenda. And we've got that in abundance. I mean, in the interest of time, I won't bore you with lots of compelling evidence that demonstrates that if you eat like your grandpa, if you had your lifestyle like your grandpa, certainly my grandpa, then that will lead to improved health outcomes. And prevent some of these diseases. But sadly, we have kind of moved on to these westernized approaches. And sadly, those are the things that are killing us.
Yeah, I mean, I'm an advocate. I'm a fan. I'm feeling maybe that you should write a book based on your granddad's story and maybe other stories from that generation and bring that back to life, because I do think that future generations will be looking for alternatives to what, as we have seen, especially in the West, as the sort of pharmaceutical options, and there has to be another option. Fascinating, absolutely fascinating. And you're the first person in Africa Health Week to highlight the role of tradition and herbs. And I want to thank you for sharing that story, and thanks for joining us, Professor.
Oh, that's great. Thanks for having me. I mean, there are so many imperatives on why we should utilize these approaches. List of which is we cannot afford the rising and escalating costs of healthcare. We just can't afford, even in the United Kingdom and or the US, we just can't afford that. We can't afford people dying from preventable causes, and we can't afford not utilizing resources that are at our doorsteps. So we really need to galvanize efforts to really make sure that these are safe, that they are effective, and they are utilized in a responsible way. I believe there is enough space there for herbal medicines, but they just need to be done properly.
Brilliant. And perfect note to end. Thank you for joining us, Edward. Fascinating story there. That's Professor Edward Kunonga, who you can watch that presentation again on the Future Health YouTube channel if you want to go through those slides, make a point, and of course, make a comment in the chat, stay on the network, and continue the conversation about that role, potential role of traditional herbal medicines and treatments.